this how this system has been dramatically perturbed from really the very beginning of the current head of the HHS in his tenure. So that's why we just have no idea where we stand right now. So I get a lot of questions about the vaccine availability. Will I be able to get the COVID-19 shot this fall? And if so, when? My guess is that yes, we will be able to get it. It may be more difficult to get just because of all the confusion, but it should be available. Will insurance cover if you're not at a high-risk category, if you're under 65 and in reasonable health? And the answer is we don't know, but anecdotally, I've heard from many insurance companies and people who have talked to insurance companies, and they're all likely going to cover people at high risk. I've heard, I haven't seen in writing, I've heard, for example, from Anthem Blue Cross and Blue Shield of California that they will be covering it for people at high risk. Can you get it off label, meaning can your doctor prescribe it even if you're not in the high risk category? And the answer is I don't know. And will pharmacies and doctors even have enough supply? I suspect they will, but you can imagine if you were a pharmaceutical executive, how much vaccine do you want to produce? And if you're a pharmacy buying it or a doctor's office buying it, how much do you want to buy? All of these problems are self-inflicted. So here are the current COVID recommendations, looking at what the FDA has approved, but still not having the CDC's imprimatur. The old recommendation for people over 65 is get a COVID vaccine if you've not received one, and get boosters when your doctor recommends, which for people over 65 and certainly over 75 would be every 6 months. The new proposed recommendations is they have not currently changed, but again, we don't know how they may change. For people 18 to 64, the old recommendation was get a COVID vaccine if you have not received one and get an annual booster. The new proposed recommendation is a COVID vaccine or booster is not needed. I disagree with that. For people 18 to 64 with underlying conditions or a condition, get COVID vaccine if you've not received one and get an annual booster. The new proposed recommendations have not been changed. I don't think they will change. If you're healthy children 6 months to 17 years, the recommendations up until very recently were get a COVID vaccine if you have not received one and get an annual booster. The new proposed recommendations are parents should consult with their child's pediatrician in a, quote, shared clinical decision-making process, which translates to you should talk to your pediatrician and get his or her advice as to whether you should get it. It means it's not recommended. And that word recommended is pivotal because if the CDC does not recommend a vaccine, insurance companies do not have to pay for it. There may not be an approved vaccine for healthy children 6 months to 5 years. Pfizer had authorization to do that, but just last Friday, the CDC sent a letter to Pfizer saying they're seriously considering not approving the vaccine for children 6 months to 5 years. Please remember back to what I showed you in terms of the state of the pandemic, in terms of young children, especially children less than 1, and their mortality and morbidity rates. And it's very likely that there will not be an approved vaccine for them. Also, I'll speak to later, but the vaccine is no longer approved for people who are pregnant unless your doctor advises it. And the major reason for getting the vaccine if you're pregnant is that in pregnancy, you're somewhat your body is immunosuppressed, so you don't reject the fetus. And we know that pregnant women have higher morbidity and mortality than other women their same age. The other reason we urge pregnant women to get vaccinated, particularly in the third trimester, is because the antibodies that mom produces cross the placenta and go into the fetus. So when the fetus is born, the fetus has mom's immunity to COVID, because we can't vaccinate children until they're above 6 months of age because the vaccines don't work well. So the only protection those infants get is mom's immunity. And remember again what I was saying about children less than 1 year of age and how they're hospitalized at a much higher rate and how they die at a much higher rate than other children. So pregnant women, I was just talking about that. The old recommendation is that all pregnant women should get a COVID vaccine or booster. The current recommendation is it's no longer needed. Kennedy came out and said on X, he said he was proud to announce that the vaccine would no longer be needed for pregnant people. So let's talk a little bit about what's happened since February 13th when RFK Jr. became the director of HHS, appointed by the president. As of today, he's been in office 182 days. And I'm going to take the liberty of just showing you not everything he's done in those 182 days in regards to vaccines, but a lot of what has happened. On April 15th, there was a very well-known, highly respected researcher and physician at CDC named Fiona Havers. She presented her data to the ACIP in April. That was the ACIP that had been same members, the 17 members, all vaccine experts. She resigned a month later for reasons that I'll show you. On May 17th, the FDA approved Novavax's COVID-19 vaccine, but only for older people and those at high risk. In other words, it was previously approved for everybody 12 and over, and now they restricted it. On May 20th, the FDA outlined its stricter COVID vaccine booster approval standards for healthy people. They said that they wanted double-blinded, controlled, placebo-controlled studies. Those are very good studies, and we always do those for new vaccines, but we don't do those when we're just changing the composition to cover how the virus has changed. For influenza, we've done this for decades, and we don't do double-blinded control studies when we just make minor tweaks in the vaccine. Furthermore, to do a double-blinded controlled study on a vaccine against COVID when it's constantly evolving means that by the time that study was done, the studies that it was done to protect us against those strains of the virus would have been long gone. So it's completely, well, it sounds good to the public, but it is antithetical to the public's health. On May 21st, Moderna had to, well, they quote, voluntarily withdrew the pending BLA, the biologic license application for its flu COVID combination vaccine for adults 50 years and over. And the reason why was because the FDA had informed them that they weren't going to approve it. And all the data that they had that had been published was quite encouraging. It would have meant going in and getting one and done for a lot of people who didn't want to get 2 shots. On May 27th, the COVID vaccines would no longer be recommended for healthy children and pregnant people. I talked about that. On May 27th, also, RFK Jr. threatened to bar government scientists from publishing in leading medical journals, for example, The Lancet and the New England Journal of Medicine. On May 29th, there was a report on children's health. This was released by the MAHA Commission, put together by Kennedy. This report was filled with canards and false references, and at least one reference didn't exist. On May 29th, also, HHS canceled Moderna's candidate H5 vaccine for avian flu. This was a $766 million funding to produce for us a vaccine that could protect us if there was a avian flu pandemic. The following day, HHS canceled $58 million to the National Institute of Allergy and Infectious Disease AIDS Research. On June 9th, RFK fired all 17 members of ACIP. You probably read about that. On June 12th, 3 days later, after not going through any kind of vetting process, let me pause and just tell you that for somebody who wants to become a member of the ACIP, the vetting process takes typically about 8 to 12 months. They're so carefully vetted. RFK appointed 8 new members with 3 days of vetting process. One of them had to drop off because he had financial conflicts. So there were 7 new members. Only one of those 7 had any expertise in vaccinology and public health. Several of the appointees had publicly expressed skepticism of vaccines and several of them had been involved in lawsuits against vaccines. So essentially, he appointed an advisory committee to the CDC that was all anti-vax, except for one person. And none of them had any expertise in vaccinology or public health to any extent. 6 days later, RFK directed his newly appointed ACIP to evaluate aluminum-containing adjuvants in vaccines. Adjuvants are like aluminum, are put in the vaccine because you get a much better response to them. They're not, and they've been used for decades. The anti-vax movement has been vociferously against aluminum in vaccines as an adjuvant. We've had plenty of studies, include one that came out just 2 weeks ago, done in Denmark, that have shown absolutely no risk to the addition of aluminum to these. On June 25th, RFK cut funding to what's called Gavi, the Global Alliance for Vaccine Initiative. This supports vaccines for more than half of the world's children. The United States piece of Gavi was about 17% that Gavi no longer has. Gavi started in 2000, and it's been estimated to have saved the lives of at least 20 million children, and RFK cut that funding. On July 31st, HHS barred 8 professional medical organizations from participating as outside liaisons to the CDC's Vaccine Advisory Committee. Infectious Disease Society of America, American College of Physicians, American College of Obstetrics and Gynecology, American College of Family Practitioners, just to name a few, 4 of those 8 that were banned from advising the CDC. On July 28th, the director of the CDC, excuse me, that's a typo. So I'll go to July 31st. HHS barred 8 professional I'd repeat that. So there's some typos on there. So disregard those last 2 red bullets. Almost through. On July 7th, the American Association of Pediatrics and several other societies filed a lawsuit against RFK Jr. and the HHS, arguing that the current policies on COVID-19 vaccines pose an imminent threat to public health. On July 24th, HHS ordered thimerosal out of all flu vaccines. Thimerosal was put in multi-dose vials of vaccines to kill any organisms that would get in. When you go into a vial more than once, there's the possibility of introducing bacteria. And before this was used, people got bad infections, some very serious, from multi-dose vials. So thimerosal has prevented all of that. There's been no study that's been done that showed any problem use of thimerosal, and there have been a lot of studies. It doesn't have really much of an impact here in the United States because only around 4% of the flu vaccines are multi-dose vials. All the flu vaccine that almost all of us get are from single dose. But worldwide, multi-dose vials are critical, and it's going to be difficult. This is going to make it difficult for manufacturers to produce two types of vaccines that are multi-dose. So it will have an impact worldwide. On August 5th, RFK terminated 22 mRNA vaccine research projects worth about $500 million. On July 24th, HHS ordered thimerosal out of all the flu vaccines. I mentioned that on August 5th. I mentioned that on August 8th. You probably remember it was last Friday that a man fired 500 rounds with 200 bullets hitting 6 CDC buildings. And the intention was that he wanted to kill the people that were producing the mRNA vaccines. And that same day, the FDA signaled that it might not renew Pfizer's emergency use authorization for COVID-19 vaccine for children 6 months to 4 years. I mentioned that. I know that was a lot, but I wanted to just show you what's happened to public health just with vaccines. And vaccines are a microcosm of all the other things that are being done to our government. So vaccines, conservative estimate over the past 50 years have probably saved 154 million lives. But in the United States, both access to vaccines and public trust in them are being systematically undermined, as I've shown you, not only by conspiracy theorists, but from within the highest levels of our government. So are we prepared for the next pandemic? Well, we weren't very well prepared for COVID, and we are far less prepared now with, frankly, incompetence at the highest levels of government. So the pandemic clock is ticking. We just don't know what time it is. We've had 3 pandemics in the 21st century, roughly one every 7 years. SARS, in 2001, 2. We had influenza H1N1 in 2009, and now we have COVID. So there's surely going to be another pandemic, and it may be just around the clock, or it may be a little bit longer, hopefully the latter. So I'll conclude with this quote from Jonathan Swift in the 18th century: "Falsehoods flies, and truth comes limping after it, so that when men come to be undeceived, it's too late. The jest is over, and the tale hath had its effect." Okay, happy to take questions. Sorry to leave you on a downer, but it's very hard being in public health today.
I have a question about whether you think it's advisable for an elderly person who has no discernible immunity by titer to measles to get a measles vaccine.
Yes. So I'll sort of dilate on that. The CDC has for a long time said that if you were born before 1957, you could assume you've had measles. And if you've had measles, you're going to be immune the rest of your life. In 1963, a measles vaccine was approved for use and was used in the United States. It was taken off the market 5 years later because it was not very effective. But a lot of people may have got between 63 and 68. In 1969, the new measles vaccine was released, and that's really essentially been modified just a touch, but that's what we've been getting ever since, and that's the one that works so well. If you get the 2 shots of that vaccine, it gives you 97% assurance you will not get measles.
Mm-hmm.
So I was a relatively new doctor in Berkeley in 1970. It was 1976. I'd started in Berkeley in 75. And I was just around 30 then. And a patient came in who was about my age. And I examined her, and she didn't have a rash, but she had these characteristic changes in the inside of on her, what's called the buccal mucosa on the inside of her mouth. It only measles causes that. And I looked in there and I saw them, and she was really miserable. She had 103 fever, and her eyes were red, and she was just really sick. And I told her that tomorrow she was going to break out in a rash. So, and then she did. And I was really proud of myself for diagnosing measles, which any doctor in the generation before mine could have easily diagnosed. And then 14 days, 12 days later, I came down with measles. And I was born long before 57. And my daughter, who had been immunized, and she didn't get it, but my son hadn't been, he was too young, and he got it from me. And my wife, who was born before 57, well before 57, she got it from me. So I've never trusted the CDC's statement that if you're born before 57, you can assume you've never had measles. Sorry for going on about that. So that's why I think that if you're unclear whether you've been vaccinated or not with the good vaccine, the one that began in 69, if you're unclear about that, and you're unclear or you're just not sure you've had measles, then get a titer, a blood test like you're talking about. And if that's positive, it means you're immune and you don't have to get vaccinated and don't worry about it. If it's negative, I'd get vaccinated.
Is it the same vaccine for adults as for children that you
Yeah.
would get?
Mhm.
Okay.
Now, the only reason for pausing on that is we have 40 million people in the state, and we have the lowest percentage of cases of measles in the United States. And that's because we have some of the highest vaccine rates in the United States against measles. So the risk if you're staying here in California is really low for getting.
Yeah, I'm in Washington actually, but
Well,
I don't know.
Washington State,
Yeah,
their vaccine rates are pretty good, but
yeah.
but I wouldn't travel to Texas
I
or
wouldn't anyway.
okay, or the 40 other states that are having significant outbreaks of measles.
Right.
So
Thank you.
yeah, I'd get vaccinated.
Dr. Swartzberg, Marlene asks if COVID test expiration dates are valid. We've been told that they are probably
Yeah.
okay longer.
Yeah, they are and they aren't. How's that? They are valid if you test yourself and it's negative, you, you can't count on it being negative. It may be because it's expired. If it tests positive, it's positive. So it's like taking a medicine that's expired. It probably is still going to work, and it probably will work okay. But you don't want to take a chance on that. But if the test turns out positive with the COVID test, then it's working. And so you've got COVID. But if it comes back negative, it could be falsely negative because it's expired. Bottom line is I'd use something that's not. What I would do is I'd go and test myself with something that's expired, and if it's negative, then I go buy one that's not expired and use that. If it's positive, I know I have COVID.
What about Paxlovid? It apparently has a pretty short shelf life, 10 months or so.
It has a really short shelf life.
Yeah.
There, it would be, I would not take it.
Okay.
I mean, I would get Paxlovid that has not expired. If you're somewhere where you can't get Paxlovid and all you have is the expired, I would take that. But if you're a candidate for taking Paxlovid, I would take what you know is going to work. It's like don't find some antibiotics in your shelf that when you get sick, you just start taking even if it's expired. On the other hand, if you've got aspirin on your shelf and it's expired, take it if you're taking it for a headache.
Any other questions? Just Sally, go ahead, unmute and.
Okay. Yes,
Right.
this is off topic, but I had all three shingles vaccines, and I still got a terrible case of shingles.
Well, you had bad luck. I'm sorry.
Yeah, I guess. I mean, is it possible the vaccine wasn't any good or what?
Yeah, the vaccines,
Joe.
the first vaccine you got um, had was protecting somewhere between 60 and 80%, prevented 60 to 80% cases of measles. The new vaccine, those 2 doses of the new one that you got, which is much better, is giving 80 to 90% protection. So you fall into that 10 to 20% group that it just didn't work as well. Was it a bad case of shingles?
Yeah, it was bad. I had a couple of blisters. I went all the way from my spine, all the way under my arm, up over my left breast to my sternum.
Mm.
And it was extremely painful. I've never felt anything like it. I had no idea it could hurt that badly. And it took a couple of weeks for it to resolve. And they made me isolate where I live because they thought I might be catching. Now,
Yeah.
I had shaken hands with a man who later on I found had shingles. Can you catch it from someone? I thought you had to. It was a result of having had chickenpox.
Yes, the latter is true. Shingles is a reactivation of the chickenpox virus you got typically as a child that's never left your body and then reactivates later in life.
Yeah, so I couldn't have caught it from this person.
No, but
Yeah, okay. Well, that I didn't think I could have,
if
but it
somebody
was
could,
coincidental.
if you've got shingles, somebody could catch chickenpox from you if they've never had chickenpox.
Yeah, yeah,
I'm really
right.
sorry about shingles. The vaccine is really good and it really works well, but it doesn't cover everybody. You know, the
Is there
best.
a long shingles? Because the whole area where I had it, which was in April, is still sensitive, burns, itches.
Yeah, it's called
I have long
post-herpetic.
shingles.
They call it they call it post-herpetic neuralgia, and,
Yeah,
and it can last months and sometimes years and sometimes never goes away. But most of the time, it'll last a year and goes away.
wow.
We had a follow-up question from Marla about, are there some people naturally immune to COVID? Or is that even possible?
It is possible. We don't know. Um, we probably won't know for a long time, but there probably are some people who are naturally immune. Um, I say that because uh, our immune system it's an incredibly complex system, and it is, and as long as there's a lot of genetic variability in a population, whether it's humans or any kind of life form, it gives us the opportunity, the population, it gives a subset of the population a chance to survive by having certain qualities. For example, there are very few people on this planet, but there are some who are immune to getting AIDS, HIV.
Hmm.
So it can happen. Most people died of the plague who got the plague in the 14th century died, but there were a subset of people who were relatively resistant to the plague. So that has happened with all infectious diseases, and there's every reason to think there are some people who won't get COVID. We don't know how to identify who those people are, so I wouldn't assume that you're immune to it.
John, what about getting COVID vaccine more frequently than every 6 months, say every 4 or 5 months?
Well, the current approval allows people to do that. You can get it after 3 months. And if you're immunocompromised, you could get it as often as every 2 months. I think that what we know in terms of vaccine protection in people who are otherwise healthy, older people like us, is that uh, the immunity wanes and it wanes fairly quickly. So you've got really good protection in a month after the vaccine, 2 months after the vaccine is still good, 3 months it's still pretty good, 4 months it's still pretty good, but not quite as good as 3 months. And by 6 months, it's not, I mean, we still have some protection, but it's not nearly as good. So that's why we recommend for people at higher risk roughly every 6 months. But you know, if you got it 4 months ago and you're taking a big trip, then I would probably just go ahead and get it before you travel. Um,
Mhm.
or if there's an occasion it's gonna be high risk for you, but you just don't want to miss it, you know. So you've got some malleability in this system.
So is there a current shot available?
Yeah.
So you just have to see if your pharmacy has it and make an appointment.
It's available. I've heard anecdotally where it's a little more difficult to find. You may have to call around to different pharmacies.
Um, I think you covered whether long COVID is contagious, but is it and can it be tested for?
Donna had a question, I think.
Oh, I'm sorry, Donna. You want to unmute? Donna? Yeah. Thanks, John.
Okay, so I'm wondering about Kaiser, like, for example, just what Sarah just asked. If I wanted to get a vaccine sooner, do you think the Kaiser would allow it? Do
I
you
don't
have
know.
any idea?
I don't know. But what I would suggest doing is contact your doctor at Kaiser and explain why you want to get it sooner than 6 months and have she or he tell the pharmacy.
Okay, okay.
I think Helene has a comment on that.
It so happens that yesterday I asked my husband's doctor if he should run in and get a COVID vaccine. And he said, wait till the new ones come out in September.
That's right. That's what I would say. But there's still a question mark of when those new ones are going to come out. And I'd hate to see somebody who's past 6 months, who's older, so at higher risk, to wait another month or two to get their vaccine. When we're in a period of increasing cases of COVID in our community.
Well, that's us.
I know.
Last vaccine last November.
Yeah. Well, that's a judgment call. I think what I would do if I had my last vaccine was last November, I'd get it now because there's a lot of COVID in the community. Actually, thank you for asking that because it reminds me of something I meant to say in my talk, and that was that I showed you that how the virus had evolved, but how the cluster of all these variants are pretty similar. They're genetically very related. Well, we have lots of studies now in the lab that show that the vaccine that we got last fall or 6 months ago or would get right now likely is going to work as well or almost as well as the new vaccine that's coming out. So it's not like the new vaccine is going to be so much better. It may not be any better, or if it's better, it's probably not going to be much better. So keep that in mind when you're doing your calculus.
Jane has a question for you that I thought was very good. Do you want to unmute, Jane?
Okay, so we've lost the people that study vaccines for upcoming illnesses, etc. And we've lost muscle and all these federal health groups. Are any other countries stepping up to take leadership so that the research continues and the gains that we've made can go forward?
Yes, there are lots of countries, primarily in Western Europe, although not exclusively, that are picking up some of the slack. But you know, the United States has been the leader for so many years, and the slack that's going to be picked up by these other countries is not going to compensate for what we've lost here. Some of the slack that's being picked up is the European country, several European countries and Australia and New Zealand and Hong Kong and Singapore, to name those that I'm familiar with, are all actively recruiting American researchers. This government is making a concerted effort to destroy public health.
But will they be allowed to buy the vaccines from the countries?
Well, remember when vaccines were first released in 2000, Americans were first in line.
But there will be tariffs on those vaccines, right?
Yeah, there will be.
And I had a quick step back. Where is the measles shot we talked about? Was that the MMR, measles, mumps, rubella?
Yeah,
Yeah, you get it all as a
package.
package deal. Yes, I was first in line when they came out. So
They even have MMRV, which is mumps, measles, rubella, and varicella, chickenpox.
oh, great. So it's all in there now. Oh, even better. More questions? We've had a amazing crowd today for you, and your talk was so interesting. I'm sure we'll think of lots of questions later on. Do you think there's anything we can do about the situation in Washington as far as public health specifically, vaccines specifically, I mean, your lobby, the physicians lobby, American, physicians and all those, are pretty strong, I would hope. And yet here we are. So do you have any thoughts on that subject besides standing down at Broadway and 51st with signs?
Yeah, as well as you probably have better ideas than I have. I'm surprised that there's not more protests. What's going on is absolutely catastrophic. But one of the reasons for showing you what RFK has done since February 13th is it's like drinking from a fire hose. It's like you respond to one thing and then there's just the next day there's more egregious things coming out. And the same thing could be said from the White House too, for that matter. So it's almost numbing people. I'm dumbfounded by why people aren't in the streets.
I know some of these folks have been.
Good. Keep it
But
up.
I think, it gets a little tricky at times just to wonder if that is the way to go about it, or if there are multiple ways that we can.
Oh, yeah, sure. I mean, the
better.
usual things is write to your congressman. It does help.
Yeah.
Phone calls and, all the usual things that people talk about. If you belong to a professional society, become more active in that society to put pressure. The same thing, what's happening in public health, look at what's happening in universities right now. And I could go on, but I never thought I'd see the day when we'd see universities buckling to the government like this. Of course, I never thought I'd see the day when the government would want the universities to buckle.
A friend at Vanderbilt just told us that her project with CDC did pass somehow through a little loophole, but that the whole department is gone all around her, except for about 5 of them.
Wow.
So they're doing their best to hang on.
Yeah.
Tara, I think we have a question from Tricia. Tricia,
Yes.
you want to unmute?
Yes, can you hear me?
Yes.
Yes.
Yes, I got COVID. I got a positive reading today.
Oh.
And my question is, because I have COVID now, do I need to get another vaccine for another 6 months, or am I now have that immunity?
Yeah. Well, first of all, make sure get on Paxlovid as soon as you can.
I'm on it. I just got on it. It took me all day and 5 different people.
Good work.
Yeah.
It shouldn't be that hard. The answer is, yeah, you're gonna have a robust immune response. It's like getting vaccinated.
Okay. Thank you.
Yeah, get well quickly.
Thank you. Yeah, I'm 74 and it's not easy.
Fine. I've got a question. Can anyone hear me here?
Yes,
or?
go ahead,
Okay.
Rodney.
Yeah, this is more of a statement, I guess. Experience I had, the participant who was mentioned Kaiser, I'm also a Kaiser member, and this happened to me 3 times where I would get an email from Kaiser saying, "Okay, Mr. Ricks, it's time for you to come in for your COVID vaccine shot." And I'd say, "Okay, great." And I'd make an appointment and come in, only to be told by the nurse, "No, we can't give it to you. Just flat out cannot give it to you." And I would leave very frustrated and confused. And then finally, the third time it happened, I just stayed there in the clinic and I'm not leaving until I get my shot. And I finally kind of stared them down and they brought out some kind of a form that I needed to sign. I don't recall what was on the form, which I signed and I got the shot. That was about 6 months ago. So I guess technically I'm kind of due for another shot now, but I'm just kind of wondering at this point, what kind of a response I'm going to get when I try to get another shot there. It was a very mystifying, frustrating experience. And I never got to the bottom as to why one hand apparently didn't know what the other hand was doing. Very frustrating.
I'm sorry you went through that.
Yeah.
There, it's been 5 years. You'd think that would be enough for people to really have all of this worked out, but the reality is our systems are still trying to catch up, and
Yeah.
we're not working optimally. They haven't worked optimally throughout the pandemic. So Kaiser's been a good source of 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 delivering public health.
Yeah.
Like any organization, sometimes the right hand has no idea what the left hand's doing.
Well, it's a huge organization, and I just keep telling myself, you've got people. Organizations are made up of people, and people are,
People.
notoriously not perfect, and so things get
Right.
messed up. Yeah. Okay.
Good luck next time.
Thank you.
Mary Dexter, do you want to give your comment? I don't know I will read her comment. UCLA just got research
Right. I can read it. We can't hear you.
back. A judge declared sorry.
You were
And then
breaking
Jane
up.
had another comment too. Jane?
So what do you recommend about masking currently?
Yeah. What I'm doing, actually, my wife just before I started this talk was leaving, and she asked me, "What should I wear a mask where I'm going?" So we all have the same question. What I'm doing is, if I'm outside, I'm not wearing a mask. If I'm inside and there's not many people around, I'm not wearing a mask. But if I'm inside and it's lots of people in public, I'm going to put a mask on. If I'm going on BART, I went on BART for the first time just a couple of months, about 6 weeks ago, and there were only 2 people on that train in the middle of the day, so I didn't wear a mask. But typically, if I'm going on a place like BART, I would wear a mask. So it's like, again, that Swiss cheese defense, trying to make a judgment as to limit your risk if you can. So indoors is risky, outdoors tends not to be. Indoors with lots of people, riskier than indoors with fewer people. But maybe I'll answer it one other way, and that is I'm a little more careful today than I was 3 weeks ago.
Yeah. Okay.
And Jenny had a question, and then Charles had a question.
Can I ask my question now, because it's in follow-up to yours? I'm sorry to interrupt, except that I have been misinformed about masks all this time, apparently. My understanding was that masks protect other people and not very much protection to the wearer. And I just wonder if you could comment on that.
Sure. Masks, most any mask you wear will offer protection to other people.
Yes.
So a surgical mask, the blue masks you wear, that offers protection to other people, not 100%, but it really limits the risk to other people if you have COVID. If you wear an N95 or a KN95 or a KF94, those masks protect you. They'll filter out 94 or 95% of all viral particles that you would inhale. They're not going to be 100% because they often leak around the side. The N95 is the best because it doesn't leak as much. So they're not 100%, but they offer considerable protection to the wearer from catching COVID. So when you go to the store, I went to visit somebody earlier this morning in a rehab hospital, and there was a nurse there wearing a mask, but it didn't cover his nose. And then wearing a blue mask, the surgical masks, and those aren't going to offer them protection from catching COVID. They'll protect other people.
Okay.
Jenny, you had a question?
Thank you.
I have a comment. It says I never go in an elevator without a mask, and I don't shop without a mask. And I use my key fob to push the elevator button. I don't do this.
Yeah, well, again, we're not sure how
I
important.
haven't gotten it.
Yeah, good. Good, but you got shingles. We don't know how important hands are. I think hand hygiene makes sense for a lot of reasons independent of COVID, and maybe it'll offer a little bit of protection against COVID. So I know that Jenny had a question, or I think.
I did. The question is administrative, but how do we access this recording for those in La Miranda Village who we would like to send it to? I was also thinking of sending it to my congressman. So how am I going to do that?
And I can answer that. To access the recording over the weekend, someone will put that on the Ashby Village website. So maybe check it come Tuesday or Wednesday or Thursdays. Since Hillary is gone, I'm not sure, Craig, whether you would do that or somebody at the office. So check midweek. When you go to the website, you don't have to log in. You don't have to be a member. The upper right, there's a big red rectangle that says YouTube. Click on that, and with a little scrolling up and down, you should be able to find this and pretty much all previous presentations.
Very good, because I think it'll be useful for friends and family, but also I want to share it with the village for sure. La Miranda Village, that is. Thank you.
Okay, well, thank you all very much.
Thank
Okay.
you.
Okay, well,
You're very generous with your time and wisdom.
Dr. John, thank you for this. It was both illuminating and sobering, is perhaps the way I would put it. We do appreciate you coming back after, we missed you in the last couple of years. Thank you for giving us this update and sharing your valuable time with us today.
Welcome. It's my pleasure. Thank you. Bye, everybody.
Good night. Bye, everybody.
Good night. Thanks.
Thank you.
So Craig, I see you're still there. Will you be posting this on the website or on the, do you know?
There's a recording going on. I did not initiate that recording, so I have no idea, where it's going to show up. I think maybe, I'll get information once I, shut down the Zoom. I've seen that happen before, but yeah, I'm presuming there's, whoever, was able to initiate this recording, will, and I don't know who that would be, would know where it showed up. But once I shut down this Zoom, if I have information about where this recording showed up, I'll definitely collect that information and see if I can access the recording and convey it to the appropriate people to get it onto the YouTube channel.
Yes. So yeah, please let me know next week if you're able to do that, or if you're not able to do that for that matter, and then
Right.
I'll follow it up. And,
Right.
and then when Hillary gets back, she may know more, but there may be a staff person. But I appreciate it. And thank you, Craig and Sarah, too, by the way, for helping me
Right.
out today.
Jane, are you
Okay.
an Ashby Village or a La Miranda Village member?
Who, Jane Nielsen,
Yes.
Ashby Village.
You are Ashby. I thought you looked familiar, but I wasn't sure. Are you going to the next social event? I guess it won't be till September, will it? Oh, that's
Yes.
right. And
Yeah, probably. I went to the last one,
which neighborhood group are you in?
North Berkeley.
Okay, so you're on the other side of town, over by the new offices.
Yeah, right.
Kind of, sort of. Yeah.
Right.
Glad you could come today. Thanks for asking questions.
Oh, yeah.
Mhm.
Was really good.
Thank
Okay,
you.
thank you all.
All right.
Bye-bye, everybody.
Okay.
Mm.
Where's my sign out button?
Yeah, I'm still on. I've tried.
There's a leave. I have a leave button down in the bottom right corner on my laptop. I don't know. There should be something that says leave.
Right. Yeah.
Okay.
Or end meeting.
Thank you. Found it.
There it is.
Okay. Okay. That's meeting summary, stop AI companion features. Okay. Stop recording.